Thank you, Bill, and good morning. I think we do indeed have an impressive panel today, and hope that the proceedings of today's conversations are going to shed some light on this role of business in addressing obesity across multiple sectors. How do I? Oh, here we go. So, just to set the stage for today, arguably, business is not just about profits. Why do companies in fact exist? Why or what is the inspiration that drives founders of companies to be in business in the first place? So one unique role of business in society is that it has the ability to increase wealth, but also to improve the prosperity of people. And so this idea has been expressed a long time ago by Adam Smith, and it inherently recognizes that what's good for people may also be very good for business. At the same time, obesity is an increasing concern to business as well. So we know obesity is increasing in prevalence. In fact, over the past 3 decades, obesity has basically doubled among workers in the United States from 15% to 30%. And it impacts upon organizational interests. So probably one of the most visible ones is medical care costs or associated costs with medical issues, whether that's workers' compensation or others. But also productivity-related costs, where people are in fact not at work to produce in the first place, or they may be at work but actually functioning at a less than optimal level, so presenteeism. In addition, it affects relationships among people. It affects the social cohesion of work teams. And also, it increasingly is an issue when it comes to the objective of engagement and the engaging of workers in the organization itself. But that's just an organizational perspective. There are also issues that really impact upon workers themselves and their family. Medical care costs is not just an organizational problem. Increasingly, and in fact an increasingly large share of the medical cost is borne by the worker themselves, particularly with new designs of benefits products where, for example, with health savings accounts or health reimbursement accounts, the worker bears a lot more exposure to that financial risk. Illness burden, physical and emotional functional status limitations, and when it comes to function, how that function translates into the family context. Wages and family earnings are reduced related to obesity. And finally, stigma and workplace discrimination. So in other words, it affects both the company and the individuals. But what do we do about this? And why would business be interested to collaborate with others in addressing this issue? Well, obesity is complex. It's biologically complex. It's a social complex issue. The workplace itself is a complex social system. And any single solution is likely to only have a small overall impact on obesity. Therefore, a sustained, systemic portfolio of solutions is going to be needed. Required scale of solutions needs to reach far beyond the workplace alone. It needs to include personal efforts, but it also needs to include organizational culture change. It needs to tie to community infrastructure and physical and psychosocial environments. Societal norms need to be addressed. And so the connection between healthy companies and thriving communities is in fact bidirectional. It's probably also complementary and may even be synergistic. So partnerships among multiple sectors is going to be critical. No single sector in society can address obesity successfully on their own. Like a combination of top-down corporate as well as bottom-up community-level interventions is going to be required to see impact on public health outcomes. In addition, there's probably some level of coordination that is required to leverage potentially high-impact industry interventions, given that there are market share risk factors facing first movers as well. So putting obesity in context, we've learned a lot about the social determinants of health over time. And in fact, this model, as introduced by the University of Wisconsin, David Kindig in particular, and the county health rankings, basically shows that when you try to explain health, roughly 20% is associated with medical care, 30% associated with behaviors, 40% with social and economic factors, and about 10% with physical environment. Addressing these social determinants of health is going to be an important element in seeking sustainable solutions to the obesity issue. Education, personal responsibility are certainly factors that are important for any program to reduce obesity, but they're not sufficient in their own right. Changing the environment and the societal norms is going to be needed to reset the default that make healthy behaviors easier. For example, reducing default portion sizes, changing marketing practices, restructuring urban and educational environments that facilitate physical activity. Other speakers throughout the course of the day will touch on these social determinants, and they'll look at it from a variety of perspectives and varying levels of depth. So today, what do we know about business leaders, particularly CEOs, about their relationships and how they view their relationships with community? We've seen varying perspectives and varying views on these issues when we actually talk directly with leaders. One of the outcomes of such convening as part of the HERO Healthy Workplaces, Healthy Community efforts created a continuum where leaders basically, in a sense, place their companies along a continuum that, in a sense, drives a business case for engaging with community. Some companies really look at this from a compliance perspective, basically meeting standard or baseline regulatory standards for worker safety, or in the banking industry, it could be linked to the Community Reinvestment Act. It could be tied to community health needs assessments in the case of hospitals. But basically, there's a set of regulatory standards that are driving what the company is doing in the community. Other organizations go a little bit further, and they become charitable organizations in the sense that they provide corporate givings, campaigns that enhance company brands and image. It's good for the organization, it's good for the community, but it's not very strategic in the sense that the funds that are being used may actually be applied differently and get more benefit. So, for example, there are organizations that look at their core business and management systems and deploy those to generate health and business value at the same time. And then there are organizations that look at it as a systemic issue. Organizations that basically look at systemic solutions that are designed to intentionally generate population health, business value, and start to address the social determinants of health that are really underlying much of the challenge. So with this as a background, today's charge is very much about examining the role of the business sector in obesity solutions. Questions that we hope to address throughout the day include how can business be engaged? How does business relate to other sectors in ways that may align efforts? What are examples of business partnerships and other community stakeholders? And what are opportunities and barriers that exist to engage business? And so with that, I'd like to turn things over to Liesl Loy, our chair, who will moderate the first panel. Thank you.